Hello and welcome. I'm YCY, and today we have something exciting to share with you. Let's dive right in. In the hurried and pressure-filled rhythm of the 21st century, we often focus on caring for our physical health, eating well, exercising regularly, attending periodic checkups. However, an equally crucial aspect, arguably the foundation for a fulfilling life, is often overlooked or downplayed: mental health. Mental health isn't simply the absence of mental illness, it's a state of emotional, psychological, and social well-being that influences how we think, feel, act, cope with stress, interact with others, and make choices. Just like our physical bodies, our minds need nurturing, care, and protection. When mental health declines, it can lead to common yet debilitating disorders like anxiety and depression. These are not signs of weakness or personal failure, but rather medical conditions that require understanding, acknowledgement, and proper treatment. This article will delve into the importance of mental health care, explore the nature of anxiety and depression, two of the most prevalent psychological challenges, and provide practical strategies and methods to manage them, aiming for a more balanced and meaningful life. This is a journey that demands patience, self-compassion, and sometimes external support, but it is entirely possible and worthwhile. Part 1. Understanding mental health. 1.1. What is mental health? The World Health Organization, WHO, defines mental health as a state of well-being in which an individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. This encompasses emotional well-being, the ability to recognize, understand, express, and manage one's emotions in a healthy way. This doesn't mean always being happy, but having the capacity to experience and cope with the full spectrum of emotions, both positive and negative. Psychological well-being. This includes how we think, learn, and understand the world around us. It relates to self-esteem, problem-solving skills, decision-making abilities, and adaptability to change. Social well-being, the ability to build and maintain meaningful relationships, feel connected to others and the community, and contribute to society. 1.2. Why is mental health important? Mental health impacts every aspect of life. Physical health, mind and body are intrinsically linked. Chronic stress, anxiety, and depression can increase the risk of cardiovascular diseases, diabetes, weakened immune systems, and other physical health problems. Conversely, chronic physical illnesses can negatively impact mental health. Work and academic performance. Good mental health enhances concentration, creativity, problem-solving abilities, and motivation. Relationships. Effective communication, empathy, and trust building are cornerstones of healthy relationships, and they are closely tied to mental well-being. Quality of life. A healthy mind allows us to enjoy life, face challenges with resilience, and find meaning and purpose. 1.3. Factors influencing mental health. Mental health is the result of a complex interplay of various factors: biological factors, genetics, family history of mental illness, brain chemistry, imbalances in neurotransmitters like serotonin, dopamine, brain structure, overall physical health. Psychological factors, life experiences, especially childhood trauma, abuse, loss, coping skills for stress, self-esteem, thinking patterns, optimistic versus pessimistic. Environmental and social factors, socioeconomic conditions, poverty, unemployment, work, academic pressure, social isolation, discrimination, stressful life events, divorce, bereavement, major changes, access to support services. Understanding these factors helps us recognize that mental health issues don't stem from a single cause and require a multifaceted approach to address. Part 2. Understanding anxiety disorders. 2.1. Anxiety, from normal reaction to disorder. Anxiety is a normal and natural emotional response to stressful, dangerous, or uncertain situations. It helps the body mobilize energy to cope, fight or flight. Feeling jittery before an exam, nervous about public speaking, or cautious when walking down a dark alley are examples of healthy anxiety. However, anxiety becomes a disorder when it occurs frequently, intensely, and persistently. It is disproportionate to the actual situation. It significantly interferes with daily life, work, studies, and relationships. It causes considerable distress. 2.2. Common types of anxiety disorders. There are various types of anxiety disorders, including generalized anxiety disorder, GAD, excessive and difficult to control worry about numerous different issues, work, health, finances, family, even when there's no clear reason. This worry typically lasts for at least 6 months. Panic disorder, experiencing sudden, intense panic attacks with frightening physical symptoms, rapid heartbeat, shortness of breath, dizziness, trembling, feeling of impending doom or loss of control, without real danger. Sufferers often fear having subsequent attacks. Social anxiety disorder, social phobia, intense and persistent fear of social or performance situations due to fear of negative judgment, humiliation, or rejection by others. This leads to avoidance of social situations. Specific phobias, irrational and excessive fear of a specific object or situation, e.g. fear of heights, spiders, flying, blood. Separation anxiety disorder, excessive anxiety concerning separation from home or attachment figures. 2.3. Symptoms of anxiety disorders. Symptoms can vary depending on the type of disorder but often include a combination of emotional symptoms, feelings of restlessness, unease, tension, fear, panic, irritability. Physical symptoms, rapid heartbeat, palpitations, shortness of breath, shallow breathing, chest pain, trembling, sweating, nausea, stomach pain, dizziness, lightheadedness, muscle tension, fatigue, difficulty sleeping. Cognitive symptoms, uncontrollable worried thoughts, difficulty concentrating, mind going blank, fear of losing control, fear of dying, catastrophizing, thinking the worst will happen. Behavioral symptoms, avoidance of anxiety-provoking situations, restlessness, being easily startled, constantly seeking reassurance. 2.4. Causes and risk factors of anxiety disorders. Similar to mental health in general, anxiety disorders result from a complex interaction of biological factors, genetics, brain chemistry, psychological factors, trauma, learned anxious behaviors, negative thinking patterns, and environmental factors, prolonged stress, stressful life events. Part 3. Understanding depression. 3.1. Depression, more than just ordinary sadness. Everyone feels sad, disappointed, or down sometimes, especially after difficult events. These are normal emotional responses that usually pass with time. Clinical depression, or major depressive disorder, is a much more serious medical condition. It's not just sadness, it's a persistent mood disorder that profoundly affects a person's emotions, thoughts, behavior, and physical health. It can make carrying out daily activities incredibly difficult and rob life of its joy. 3.2. Common types of depression. Major depressive disorder, MDD characterized by at least one depressive episode lasting a minimum of 2 weeks, with symptoms causing significant functional impairment. Persistent depressive disorder, dysthymia, a chronically depressed mood lasting for at least 2 years, though symptoms might be less severe than MDD. However, its chronic nature still significantly impacts life. Seasonal affective disorder, sad depression that occurs at specific times of the year, usually during winter months when there is less sunlight. Perinatal depression, depression occurring during pregnancy or after childbirth, postpartum depression, premenstrual dysphoric disorder, PMDD, severe depression, anxiety, and irritability symptoms occurring in the week before menstruation and improving after its onset. 3.3 Symptoms of depression. To be diagnosed with major depressive disorder, a person typically must experience at least 5 of the following symptoms during a 2-week period, and at least one of the symptoms must be either depressed mood or loss of interest, pleasure. Depressed mood, feeling sad, empty, hopeless, most of the day, nearly every day. Markedly diminished interest or pleasure in all, or almost all, activities, anhedonia. Significant weight loss when not dieting or weight gain, or increase in appetite. Insomnia, difficulty sleeping, or hypersomnia, sleeping too much, nearly every day. Psychomotor agitation, restlessness, pacing, or retardation, slowed thinking, speech, movement, observable by others. Fatigue or loss of energy nearly every day. Feelings of worthlessness or excessive or inappropriate guilt, diminished ability to think, concentrate, or make decisions. Recurrent thoughts of death, recurrent suicidal ideation without a specific plan, or a suicide attempt or a specific plan for committing suicide. These symptoms must cause clinically significant distress or impairment in social, occupational, or other important areas of functioning. 3.4 Causes and risk factors of depression. Like anxiety, depression results from a complex combination of biological factors, genetics, hormonal changes, brain chemistry, psychological factors, trauma, loss, low self-esteem, pessimistic thinking patterns, and social factors, isolation, chronic stress, lack of social support, other physical illnesses. Part 4. The link between anxiety and depression. Anxiety and depression are distinct conditions, but they frequently occur together, comorbidity. Many people with an anxiety disorder also develop depression, and vice versa. Anxiety can lead to depression. The constant stress and exhaustion from chronic anxiety can deplete energy, leading to feelings of hopelessness, loss of interest, and other depressive symptoms. Avoiding social situations due to anxiety can also cause isolation and contribute to depression. Depression can cause anxiety. The feelings of hopelessness and negativity in depression can trigger anxious thoughts about the future, health, or other issues. Low energy and lack of motivation in depression can also make coping with stressors more difficult, leading to anxiety. Both conditions can share common risk factors and some overlapping symptoms, e.g. sleep problems, fatigue, difficulty concentrating, irritability. Treatment often needs to address both issues if they coexist. Part 5. Strategies for managing anxiety and depression. Managing anxiety and depression is an ongoing process that requires a combination of different approaches. Below are key strategies, from self-care basics to seeking professional help. 5.1. Foundational self-care basics. These are fundamental yet crucial elements for building a solid foundation for mental health. Quality sleep. Why it matters. Sleep deprivation exacerbates anxiety and depression symptoms, affecting mood, concentration, and stress coping ability. How to do it: establish a regular sleep schedule, go to bed and wake up around the same time daily, even on weekends. Create a comfortable sleep environment, dark, quiet, cool. Avoid caffeine, alcohol, and heavy meals before bed. Limit electronic devices before sleep. Practice relaxation techniques before bedtime. Balanced nutrition: why it matters: the brain needs nutrients to function optimally. A healthy diet can improve mood and energy levels. Some studies suggest a link between diets high in processed foods and sugar, inflammation, and a higher risk of depression. How to do it: prioritize whole foods, vegetables, fruits, whole grains, lean proteins, healthy fats. Limit processed foods, refined sugars, saturated fats. Stay hydrated. Pay attention to how your body reacts to different foods. Regular physical activity: why it matters: exercise releases endorphins, neurotransmitters that improve mood and reduce pain, reduces stress hormones, cortisol, improves sleep, and boosts self-esteem. It can be as effective as mild to moderate antidepressants for some people. How to do it: aim for at least 30 minutes of moderate intensity activity most days of the week. Choose activities you enjoy: walking, jogging, swimming, cycling, yoga, dancing. Start slowly and gradually increase intensity. Even short bursts of activity are beneficial. Exposure to sunlight and nature: why it matters: sunlight helps regulate circadian rhythms and vitamin D production, which plays a role in mood. Spending time in nature has been shown to reduce stress, anxiety, and improve mood. How to do it: try to get outdoors daily, especially in the morning. Take a walk in a park, sit near a sunny window, or simply spend a few minutes breathing fresh air. 5.2 Stress management and relaxation skills. Mindfulness practice: why it matters: mindfulness is the practice of paying attention to the present moment without judgment. It helps recognize anxious or negative thoughts and feelings without getting carried away by them, reducing the stress response and enhancing calmness. Deep breathing techniques: why it matters: when anxious, breathing often becomes shallow and rapid. Slow, deep breathing activates the parasympathetic nervous system, the rest and digest response, calming the body and mind. How to do it: sit or lie comfortably. Place one hand on your abdomen. Inhale slowly through your nose, feeling your belly rise. Hold for a few seconds, if comfortable. Exhale slowly through your mouth or nose, feeling your belly fall. Repeat for several minutes. Progressive muscle relaxation, PMR: why it matters, helps recognize and release the muscle tension that often accompanies anxiety. How to do it: systematically tense and then relax different muscle groups in your body, e.g. feet, calves, thighs, abdomen, chest, arms, hands, shoulders, neck, face. Focus on the difference between the sensations of tension and relaxation. Yoga: combine gentle movement, breathing, and meditation, improving flexibility, balance, and reducing stress. 5.3 Changing thinking patterns. Anxiety and depression are often accompanied by negative, distorted thinking patterns. Learning to recognize and change them is crucial. This is the core of cognitive behavioral therapy. Identify negative automatic thoughts. Start noticing the automatic thoughts that pop up when you feel anxious or down. They are often critical, pessimistic, or catastrophic. Examples: I'm going to fail, everyone thinks badly of me, this will never get better. Challenge and reframe thoughts. Check the evidence. Is this thought based on facts? Is there evidence against it? Look for alternative perspectives. Is there another way to interpret this situation? What would a trusted friend say? Assess usefulness. Is this thought helpful? Or does it just make me feel worse? Consider worst case, best case, and most realistic outcomes. What's the absolute worst that could happen? The best. And what's the most likely realistic outcome? Practice self-compassion. Treat yourself with kindness, understanding, and acceptance, just as you would treat a friend who is struggling. Recognize that suffering and imperfection are part of the human experience. 5.4. Behavioral and lifestyle adjustments. Behavioral activation, especially helpful for depression. Why it matters. Depression often causes loss of interest and withdrawal from activities. Behavioral activation aims to break this cycle by encouraging engagement in activities, even without initial motivation. How to do it? Make a list of activities that once brought joy or a sense of accomplishment. Schedule a few small activities each day, regardless of mood. Start with easy tasks and gradually increase difficulty. Notice how you feel after completion. Gradual exposure. Why it matters. Avoiding feared situations only reinforces the fear. Gradual, systematic exposure to the feared object or situation in a safe environment helps reduce the anxiety response over time. How to do it? Usually done with therapist guidance. Start by identifying feared situations and ranking them from least to most scary. Gradually confront each step, starting with the lowest, until anxiety subsides before moving to the next. Set realistic goals. Break down large tasks into smaller, more manageable steps. Acknowledge and celebrate small achievements. This helps build a sense of accomplishment and control. Build and maintain a social support network. Why it matters. Connecting with trusted people provides a sense of belonging, emotional support, and practical help. Social isolation is a major risk factor for both anxiety and depression. How to do it? Make time for people you care about. Share your feelings with someone you trust. Join hobby groups, clubs, or volunteer activities. Consider joining support groups for people with similar mental health challenges. Set healthy boundaries. Learn to say no to excessive or inappropriate demands. Protect your time and energy. This helps reduce stress and feelings of overwhelm. Limit exposure to negative news and social media. Constant exposure to negativity or comparing yourself to others online can worsen anxiety and depression. Limit your consumption time and be selective about your sources. Find hobbies and meaningful activities. Dedicate time to activities that bring joy, relaxation, or a sense of purpose. Reading, listening to music, painting, gardening, playing an instrument, volunteering. 5.5. Seeking professional help. Self-care is vital, but sometimes it's not enough. If anxiety or depression significantly impacts your life, seeking help from mental health professionals is a necessary and courageous step. When to seek help? Symptoms persist for more than a few weeks. Symptoms cause significant distress or severely interfere with work, school, relationships, or daily activities. Self-help strategies aren't sufficiently effective. You have thoughts of death or self-harm, seek help immediately. You are using alcohol or drugs to cope. Types of professionals: psychiatrist, a medical doctor specializing in the diagnosis, treatment, and prevention of mental illnesses. They can prescribe medication and may also provide psychotherapy. Clinical psychologist, a professional trained in assessing and treating mental health problems through psychotherapy, talk therapy. They typically do not prescribe medication, with some exceptions in specific locations. Clinical social worker, marriage and family therapist, MFT, licensed professional counselor, LPC, mental health counselor, LMHC. Other licensed professionals who provide psychotherapy and counseling. Psychotherapy, talk therapy, cognitive behavioral therapy, CBT focuses on identifying and changing negative thought patterns and behaviors contributing to anxiety and depression. Highly effective for both conditions. Dialectical behavior therapy, DBT, originally developed for borderline personality disorder, but also effective for other issues. Focuses on teaching skills for coping, emotion regulation, distress tolerance, and improving relationships. Acceptance and commitment therapy, ACT, helps individuals accept difficult thoughts and feelings rather than struggling with them, and commit to actions aligned with personal values. Psychodynamic therapy explores unconscious influences from the past, childhood experiences, relationships, on current thoughts, feelings, and behaviors. Interpersonal therapy, IPT, focuses on improving interpersonal relationships and social skills to alleviate depressive symptoms. Medication, for moderate to severe cases of anxiety and depression, a psychiatrist may prescribe medication. Antidepressants, the most common are SSRIs, selective serotonin reuptake inhibitors, and SNRIs, serotonin norepinephrine reuptake inhibitors. They work by adjusting levels of neurotransmitters in the brain. Medications take time, several weeks, to reach full effect and can have side effects. Never stop medication abruptly without consulting your doctor. Anti-anxiety medications, anxiolytics, often benzodiazepines, e.g. Valium, Xanax. They work quickly but carry a high risk of dependence and addiction, usually prescribed for short periods or on an as-needed basis. Some antidepressants also have anti-anxiety effects. Important: medication is often most effective when combined with psychotherapy. Medication use requires a doctor's prescription and close monitoring. Part 6. Breaking the stigma. One of the biggest barriers to mental health care is social stigma. The fear of judgment, shame, or being seen as weak prevents many people from seeking help or talking about their struggles. To break the stigma, we need to educate, understand that mental health conditions are real medical issues, not personal failings. Talk openly, share experiences, if comfortable, and listen to others without judgment. Use respectful language, avoid derogatory or minimizing terms for mental illness. Show compassion and support, let those who are struggling know they are not alone and that you care. Treat mental health like physical health, encourage seeking professional help as a normal and responsible action. Conclusion: a journey of continuous care and hope. Taking care of your mental health and managing anxiety and depression is a journey, not a destination. There will be good days and difficult days. What matters is persistence, kindness towards yourself, and applying the strategies that work for you. Remember, you are not alone. Countless people experience similar challenges. Anxiety and depression are treatable conditions. Many effective treatments exist, from self-care to professional therapy and medication. Seeking help is a sign of strength, not weakness. Every small step counts. Acknowledge your efforts, no matter how small. Hope always exists. With the right support and strategies, you can absolutely find balance, joy, and meaning in life again. Begin your mental health care journey today. Investing in your mind is just as important as investing in your body. It is the foundation for a healthy, happy, and fulfilling life. Thank you for watching. I hope you found this helpful and enjoyable. Don't forget to follow for more, and I'll see you in the next one. Take care.